Welcome to the WED WEB CHAT. This is Karan Chandran, the publisher of stormasia.com, and this is our regular series of discussions on issues that impact the way we live, the way we work, the way we play, and today, the way we hurt too. Past discussions have covered a variety of topics ranging from peace in wartime to launching a new brand, technology in our lives, anything topical and trending. Now, previous WED WEB chat sessions can be found on the storm-asia.com website, so you can always watch them at your leisure. Now, today's session is about pain. It's a painful topic. It's also one that we have to deal with almost everybody at some point or other in our lives. Today we want to talk about how we manage this pain in our lives. We have all endured pain to differing degrees of intensity, from a stubbed toe to a broken limb or a cancer that gnaws away at you. Pain can hit you anytime. An injury, an illness that decides to manifest itself, a headache, it's a toothache, it's all that. Now, how do you react to it? And that becomes quite important because acting promptly could prevent it from getting worse. Ignoring it could result in things worsening and making your pain unbearable. And today's panel includes two pain physicians and a cheerful sufferer. And I'll introduce them to you. Okay, Dr. Bernard Lee is a consultant pain specialist with over 20 years of experience in interventional pain management. Dr. Lee specializes in managing chronic and orthopedic pain conditions through minimally invasive procedures and multimodal treatment approaches. He developed the proprietary painostic approach built on years of clinical experience. A physician, Sue Wan, who is the leading physician at Singapore Pain Care TCM Wellness. She has over a decade of experience. She has been instrumental in shaping the clinic's integrated approach to pain care and wellness. Sue's expertise spans pain management, pediatrics, dermatology, and suboptimal health. And now we have Jem Ng, who heads the PR and communications department in her company. The story of her physical pain began when she was part of the SIA cabin crew. A workplace injury that was misdiagnosed resulted in years of constant daily agony. It involved 14 major surgeries within just a year. The multi-talented Jem still sparkles with a winning smile. And whether she's cycling or playing the pipa, she's always game to try anything new. So let me start by asking Jem to talk us through what happened to her and how she wound up living this life of pain.
Okay,
Jem.
so hi everyone. I'm Jem. So basically what happened was in 2012, I think, during my SIA time, during a flight from Brisbane to Singapore, I was helping a passenger who was a very tall Australian lady with her bag. So she was behind me trying to stuff her bag into the overhead compartment. And then I saw that there's something underneath and she couldn't whack it in because there's something that's blocking the way. So she tried to push it into the overhead compartment, then being shorter and smaller. So I saw her and then I told her that, oh, ma'am, let me take over so I can push it away, push the obstruction away. So after that, when I took over and I push it, then it's free to move, right? Then from behind me, she pushed the bag in, pulling my hand with the bag, into the ovate compartment, and then my hand was trapped between the bag and the ovate compartment, and I was shorter, so I was lifted off from the ground, and I started tearing and crying, and then yeah, so it felt maybe it was a few seconds, but it feel like hours for me. It was in pain. I was screaming. Then at that time I thought my pain was here, so I do cold compress over here. But in the end, it's actually a muscle tear over here because I was stretched into the ovate compartment. So with that, when I reached Singapore, I went to CGH. And I met a doctor whom didn't listen to me when I tried to explain what happened. He said, "Oh, SIA stewardesses, I know what happened. Don't worry. I don't have to listen to you. I know what is happening. I give you two steroid jabs and you can move." So once I had that steroid jabs, I was young at the time, so I didn't know that, oh, what's the effect of steroid and why can I move then? So I thought, oh yeah, he's right. That yeah, he diagnosed it correctly, then he really understand cabin crew. That's why I can move. Then who knows? I continue eating painkillers for another 6 years. So 6 years later, a doctor finally tell me, I think you eat too much of painkillers already. You should. I want to diagnose you. I want to find out what happened. So he being a GP, he didn't want to. He just let me buy painkillers at first, but he looked into it. Then I was saying, oh, I don't remember having any other pain except for my neck. So then he examined and he said that, oh, I think you have muscle tear on your shoulder. I believe it is that. I trust my own diagnosis. Then he forced me to go to a MRI to do it. And then yes, I have a very big tear with fraying muscles. And then I went for that was the start of my operations. I did 14 surgeries to fix it. So at that time it was fraying so bad. So the doctor has to burn it off and then sew it together. So I was like this, deformed for a year. Then I have a lot of other things like I remove my C4 C5. I do this replacement. I also did this muscle tear surgery, frozen shoulder surgery, pain surgeries, and then a few other surgeries. And then I fainted as well. So I broke my nose, my teeth, and then I did more like more surgeries. So with that, after that, I finally feel better. Rely less on painkillers, and I in recent years, I mean yes, actually few months ago, I went for my last surgery, to manage pain. So yeah, now I'm trying to have a painkiller free life. Yeah, that's about it.
But not a pain-free life still. So you're still living with pain, right?
Still living with pain, just lesser pain.
Uh, was there at any point that the doctor said you would be free of pain totally?
Um, I don't think, yeah, anyone said that to me.
Okay,
Yeah.
all right. Okay, let me move over to Dr. Bernard Lee. Uh, having heard what Jem has just said, be great to get your perspective on it and also to try and understand from you, how you define pain and what are the different sorts of pain that you can expect and how you can go about dealing with them.
Very unfortunate that Jem went through so much experience. Well, first of all, pain itself is an alarm to tell us that something has gone wrong. And pain is meant to be protective in a certain sense of it highlights the need for some attention, whether it's to rest it, whether it's to seek treatment, or whether it's to fix something, whatever. So pain as an alarm works pretty well. However, when pain persists for a long time, when it goes past 6 months, 6 weeks, 3 months, in Jem's case, 10 years, sounds like 10 years.
Yeah, more than that from 2012.
In her case, has the alarm system, is it still reliable? Is it faulty? So she's experiencing pain, for sure. We are not trivializing it. We are saying, yes, whatever she's feeling is painful. However, to match whatever the pain that she's feeling to the underlying condition, that is the challenge. When it's a simple acute problem, we want to fix the problem. We want to get rid of the pain generator. By fixing the problem, the pain signal goes away. That's how the body works. You break your arm, you fracture something, you fix the arm, you fix the bone, pain goes away. So if the diagnosis is wrong, then whatever that is treating doesn't help it. And when pain persists beyond a certain period of time, it takes on a life of its own. What I mean is that there are many cases and many scenarios whereby after the pain generator has finally been diagnosed and been removed, the pain sensation, the experience can continue to persist. Those becomes troublesome. Those are what we call a different category of fish altogether. I may take a step back now to say that pain itself is categorized broadly into three big groups. One, we call it mechanistic or mechanical pain, whereby just now I was trying to explain what Jem is trying to, okay, so there is a cause to her pain. So something broken, something, whether is it a muscle that's torn, whether is it slip disc of the neck causing her pain in the shoulders or in the hand. So they're chasing after that pain generator, the mechanical cause of pain. It's a bit like you have cancer, and therefore you got cancer pain. So you remove the cancer tumor, the cancer pain should go away. That's mechanical. The second group is we call nerve type pain, whereby there's no mechanical, you couldn't see anything, but the nerve system, it is whether there is what we call injured, the nerve itself is injured, the nerve is sensitized or whatever. So like diabetes nerve, you can't find it. Yep. You can't seem to see it, but diabetes itself can affect the nerve. You have a stroke. The stroke is there, but then why is it painful in the part of the arm that is not moving? Stroke type pain. So, yep, we understand it as nerve pain. Last group is the one that is a bit tricky. It doesn't follow mechanical, it doesn't follow nerve, it follows an animal of its own. So we call it nociplastic, or even in the other groups, we call it secondary fibromyalgia. So whereby the pain generator is no longer, it doesn't correlate too well. The pain generator and the pain we experience does not have a linear relationship. Sometimes you may have people whereby they have knee arthritis, starts off as a knee pain. They do a knee surgery, do a knee replacement, whatever. The pain of the knee continues to persist. The knee has been fixed. Yep. Maybe I give you a better example to kind of sink in. A patient, war veteran, they caught in a war, the leg got blown up, and then there's a lot of pain, and then couldn't save the leg, and then have to amputate the leg. So the patient had a lot of pain before the amputation sets in. Maybe it took about 3 months, and then there's a lot of pain experience, a lot of what we call sensitization or amplification of the pain signals. Finally, the amputation occurred. The soldier lost the leg. Shouldn't have any more pain, right? But many pain veterans continue to complain of the missing leg, a leg that is not there and is still painful. We call it phantom pain. So that's an example of what we call nociplastic kind of pain, whereby the pain generator doesn't match the pain experience anymore. And maybe that's what Jem is experiencing. This is the first time I met Jem. I've never examined her nor made a diagnosis on her before.
With these sort of phantom pains, how do you treat them then?
Nociplastic pain and phantom pain are quite difficult pain conditions to handle. So because the pain generator is no longer obvious. So once the nerve has been amplified or sensitized, it's a bit like you having a sensitive tooth. There is no decay, there is nothing, and then you got to figure out how to desensitize that sensitive tooth. It takes what we call a multimodality approach. From the mechanical perspective, we try to desensitize the nerve, like a root canal, right? So for a root canal, they go in and fix the nerve to make the nerve less sensitive. However, there are many patients who after root canal, they still have the sensitivity. Same thing with medical practice. We try to desensitize the nerve. If there is a certain root of the nerve that is affected, we can identify that nerve. We can even do things like what we call spinal cord stimulation. We put electrical current into the nerve to desensitize it, to kind of mask it or to change the signal, to block the signal of the pain. So that's one way. I mean, other ways will be things like they will use either psychological ways to frame the mind, to harness certain brain pathways to what we call block the pain signals. There are other ways of from the TCM approach whereby they will use acupuncture to harness energy flow functionally. We call it functional pain treatment, whereby using energy, qi, and to be able to see whether that also can be done for this kind of pain conditions. Yeah.
Okay, great. That sets us up nicely for Sue to talk a bit about TCM and how you approach pain and how also how this complements the Western method, Western approach to dealing with pain.
Before I start, I would like to know, Jen, at any point do you try going to a TCM or doing any form of other treatment?
Yes, I did. Because I try every method. So basically so to continue from my surgeries, right? I went for 1 year of physiotherapy. I was still deformed. Now I can sit up straight is because I went for TCM. So I don't know whether it's a compliment or it's because TCM helps me or something, or it's totally different method. So apparently I went for TCM. I did bone setting, and then the person pulled me back, and I didn't feel much pain, but I can bring it back to original straight position. But after that, I can't really bend lah. I can only go straight. Yeah. So but it helps to eliminate the pain that I was experiencing for not being able to lie down, because gravity will pull, and then I will pull all my muscles over here as well. So now I feel fine. And then I also went for some I take some herbs whereby it will help with the blood circulation, and also I did cupping as well, and also 针灸, all these things.
Okay. So you have done, I would say, many of the TCM treatments. Usually from TCM point of view, I would say in the big picture, TCM treatments are, I would say, it's a very good complement to Western form of treatment. So especially after you have done the procedure, done the surgery, then the next part is the rehab part. And I would say, so you did physiotherapy and you also did TCM, which I think goes very well hand in hand together. I mean, physio is an active movement. It get you to, help increase your mobility, strengthen your muscles. But at the same time, TCM, you can say more or less is a slightly more passive treatment because you lie down there and then we do things for you or to you. I would think that as a post procedure, it is a very good approach. And strictly talking about TCM, for us, we look at that from a pretty different concept. We look at the causes, so whether it could be physical, it could also be emotional. So we do have some patients that you realize that it affected their sleep, and then their moods got worse than before. And for this group of patients, a lot of times their pain becomes more prolonged. Like it prolongs it, they do not recover as well as people who tend to have a positive outlook. Your lifestyle plays a part, how active you are. From there, we do diagnosis of a syndrome. So for even for pain, you have the type that, like, say, block circulation. There's also a type of pain that is like your body is weak, so you are experiencing pain, and which is why the herbs, like, other than promoting circulation, there might be some herbs that are a little bit more tonic. Yeah, more tonic to actually help to build up your energy as well. So I would say that different patients, we will end up prescribing different herbs and doing slightly different treatments. Yeah. And doing an acupuncture, I would say, is a very good form of treatment. One is to improve the circulation, and secondly, when we put in the needle, it kind of also signals. I mean, at least you put a foreign object inside, it kind of signals your immune system, hey, go and do something about it. But the most important thing to us is still circulation. And we also choose some points that we know that, oh, if you have certain weakness, like your energy is not enough, we do put in like some points that we know, okay, it's good for your energy. And you mentioned you did some bone setting as well, right? Yeah. So yeah, bone setting, at least in Singapore context, usually we have to be very careful about it. You also may realize not every physician does bone setting because it requires a lot of practice. From what I hear, it does sound like a form of, I would say, in people call it bone setting, but in TCM, like in a more physical sense, it seems like we are doing a bit of like adjustment of of that joint or of all the muscles and tendons that's around the area.
For handling, like in Jem's case, condition, you said it was an unconventional approach. Is TCM still viewed that way, or is it more complementary between Western and Eastern medicine?
I would say it's on the way to becoming more complementary in the big sense. But I would say a long time ago, I mean in Singapore, before, for instance, the TCM board is formed, there are people who don't believe in TCM treatments. Yeah. But I would say that in time to come, there have been more evidences because I mean, especially in Western medicine, we talk a lot about evidence-based treatment. And for TCM, it is gaining traction, even like in terms of study, the efficacy of different herbs or different acupuncture methods to treat a certain condition. Yeah, so it's starting to be closer to complementary medicine. But I would say the one method that is quite I would say more recognized would be acupuncture out of all the treatments out there. Yeah, but you will still have a long way to go before it is actually seen as conventional.
Just on the point about this TCM accepted as conventional, I think we all, well, at least the medical fraternity sees TCM very much like physio, like chiro, like supplements, like wellness. Yeah. So they are as mainstream as any of those. So a physio is well recognized to be able to help with certain conditions. So TCM has its role to be able to help with certain conditions. At the end of the day, it boils down to getting the right diagnosis and getting the right solutions. I think that's the challenge. One patient goes to the chiro will say everything is got to do with the misalignment of the spine.
Yeah.
Jen most probably has been told that.
Yeah.
Or you go to see a spine surgeon, everything is got to do with the spine as well. So at the end of the day, it's I always say the patient is the big elephant, and everyone else is the blind man. Everyone feeling different parts of the elephant.
Yes.
And everybody is forming their own impression.
Yeah.
So
So
yeah,
I had 6 surgeons coming to me to check on all different parts. And then all have different diagnoses. Then they will, like every morning when I was in the hospital, they will start to have meetings to say what they think it is. And then they come to me and then check before they operate on me.
if medicine was a very linear relationship, it would have been easier. Cause and effect is very simple. Most of the time it's easy. Things like, for example, a fracture. You know, if you fractured your wrist on the day the accident happened, very clear, very easy. If the day after you push that back in and then the MRI shows there is a swelling whereby the soft tissue has been torn, pretty simple. Maybe it wasn't so simple. So that's why the investigation wasn't that clear. The injury wasn't that that extreme. It's a bit like saying you have you wear high heels and then you twist and you sprain your ankle, and then the ankle pain persists even though after the MRI of the ankle has healed and everything, but the pain persists. And that becomes the problem. Then everybody starts saying, what's the cause of the pain that is remaining there? Then everybody will have a different idea of what it ought to be. So the different blind men feeling the different parts of the elephant.
Dr. Lee, so could you tell us a bit about your painostic approach?
Yep. So I'm a pain specialist. I'm like the A&E of pain, accident emerging. I see all kinds of pain conditions, and I have to make sense of the pain. So as I started saying, pain is not a linear relationship whereby pain generator and pain experience is the same. So it's not. So in our painostic diagnosis, we actually evaluate the mechanical, which I started off explaining, and we also look at the functional, which I ended off saying there's like nociplastic. So we actually will make that diagnosis based on mechanical and functional and make sense of the whole picture. So if Jem came to me on that day 20 years ago, I would make that evaluation. So that diagnosis itself will carry a lot of different other things, whereby sometimes a simple sprain, you have to understand the natural history of a simple sprain. The more severe the pain doesn't always necessarily means the more severe the underlying pain generator or the pain condition or the underlying condition. Sometimes the pain is so bad, it can be so bad, incapacitate the patient, unable to move and all that. And we're inclined to think that it must be pretty bad. The underlying condition must be really like dislocation, fractures, tumor, cancer, or all the bad things that can happen. Not necessarily always the case, right? Like Sue was mentioning, sometimes can be a simple muscle sprain, but it can present itself with very severe very severe pain. So it boils down to understanding the diagnosis, and then after that, being able to formulate a solution for the patient. Because some pain we actually want to protect, and we say, "Hey, sayang, don't move, rest." Some pain you actually want to say, "Hey, let's tough love, let's go and engage the pain." So knowing that takes wisdom and takes experience. Because you get it wrong, you're going to get bad outcomes. So if it's a condition that needs to be resting, that means you don't engage the pain by doing more because you say, "I'm going to tough it out," you actually can aggravate the condition and make it worse. And that's what everyone worries about. But on the other hand, an overly protective doctor or protective family members or whatever, whereby some pain ought to be engaged, like just now what Sue was saying, a muscle sprain ought to be engaged. Engaged meaning that work with it, use it, move it, rather than protect it, rest it. Yeah. So we need to understand the real diagnosis. Coming back to my method, what we call the painostic methodology, we understand the pain generator very well. So we understand the natural history of all the conditions of pain. We understand and we can match very clearly what the pain experience or the pain report is to the underlying. So we will cut across all the disciplines, whether it's orthopedic, neurology, rehab. You have to cut across, as a pain specialist, we need to know all of them and be able to understand what is the underlying cause. There'll be some specific conditions whereby the natural history of a certain injury can become pain-free despite the fact that it doesn't heal. Let me give you a fracture. A fracture that doesn't heal after 1 year is no more pain. Whatever that's pain that's left may not be due to the fracture. maybe many other reasons. So using Jem's example about tests here, tests there, and all that, I'm not saying that all conditions of all injuries naturally will go that way. I'm saying some. So being able to understand the natural history of the condition helps a lot. So with the painostic approach, we are able to evaluate that very clearly. We don't look at the MRI itself alone. We don't look at the X-ray itself alone. We see the whole patient. We see how the patient interacts with the pain. We see how the pain affects the patient and how the patient is able to handle. Just now, Jem started talking about, she is saying low pain threshold. That is another big topic that people like to talk about. Yeah, you're such a wuss. You're such a wuss that you can't even take a little bit of pain. It's like, oh, your tolerance of pain is so poor, and then start to blame, that individual. I feel that is not accurate. Yeah. Although that can influence the interaction of how pain is being experienced. So bottom line, I don't like the word pain management. In fact, it's almost saying that you got no end. The only time when you manage the pain is whereby I can't get rid of the pain generator, whereby it's like cancer. I can't get rid of the tumor. The tumor is eating up and there's no way. Okay, I manage. I make the pain better. I palliate it. Many cases of degeneration and wear and tear, degeneration of the knee arthritis or back arthritis or bone spur, there is actually something that can be done. Sure, whether do we want to do the surgery, whether do we want to do, or is it absolutely necessary? I think that's always the question. Is it always absolutely, is there no other choice? Is there an alternative way of treating that problem? Can acupuncture solve it? Can what Gems goes through, physio or exercise and she, relearning herself, can all that help? Yeah, sure. For the medical doctor, we want to get rid of the pain generator. Can we do the removal of the pain generator in a less invasive, less surgical manner? We are moving towards into a lot of minimal invasive. We use specialized injections. We use special needles and solve the problem.
In aging society, there'll be some pains that will come up. How do you sort of understand, okay, this pain is part of the process. What can I do? When should I see a doctor? When should I just sort of maybe take it easy?
I think
First of all, no pain is good pain. So no pain is a good pain. Okay, the only time when it's a good pain is I call it when you intentionally work it out, like when you go for an exercise and you really want to train and want to grow muscles and all that, right? That one I call it good pain. There's such a thing called good pain, whereby you are literally working it out. But of course, you over push yourself, then the good pain becomes bad pain because you injured something. That's always a threshold whereby you do enough to make you move to the next level of stamina and strength. And then, but you do too much, then you're training for high rocks, and then the injury stuff. So an injury that is persistent, and then we want to get rid of the pain generator, we try to heal it, try to stop it, and get rid of it, and done. No pain is good pain. Any pain that lasts more than 6 weeks to 3 months, unlikely that the pain will go away by itself. That means being an ostrich in the ground and ignoring it is not going to go away. So the approach to a pain that is more than 3 months, you got at your disposal, you got so many things you can do. You can go and see a physio, you can see a chiro, you can see a TCM, you can see a GP, you can see a specialist, you can see the A&E. So seeing all these doctors is to try to understand. All doctors are trained to have that linear relationship. Pain experience, pain generator, they are trained like that. Only the pain specialist is trained in a funny way whereby we see everything multifactorial and multidimensional, whereby pain is no longer a linear relationship. For simple acute injury, it's always linear. For persistent pain, it goes beyond 6 months, 3 months to 6 months. There are many other things that are into this whole mix. Pain is to tell you something is needing your attention. Don't ignore it. Neuropathic pain means that he understands that it's called nerve type pain. Nerve type pain whereby the nerve injury causing the pain by the nervous system. So some examples of these will be things like shingles. When you have chickenpox and post shingles, yeah. So the shingles virus attack the nerve and the nerve gets injured. Alternatively, there'll be diabetes of the peripheral neuropathy. Yeah. There are other very, very specific nerve type pain like trigeminal neuralgia. Some nerve type pain can be even migraine kind of nerve type pain. So neuropathic pain is very broad. Generally, we always say, number one, what is the underlying cause? Can we reverse it? Number two, if we cannot reverse it, then we managed it. Yeah. Most of the time we try to reverse it. We can. So you go to different doctors, different doctors will tell you different things. If you talk about neuropathic pain from drugs relating injury, like for example, a patient undergo chemo, so their nervous system is injured by the chemo, they get neuropathic pain. Those are harder to treat. Those are one we can reduce their pain, but we can't eliminate it. Whereas if you talk about trigeminal neuralgia, we can remove it. We don't just need to palliate it.
What is your formula, rather, to live a pain-free life? Sue?
I have this tagline sometimes that I do tell some of my patients: everything in moderation, including moderation. So for some of our patients, sometimes they do ask me like, oh, like, should I eat something to improve circulation? Like one of the good example is like saffron. Saffron in TCM helps with circulation. And then they keep taking it every day until taking too much of any herbs can have certain side effects. Even though it was maybe like initially meant to treat the pain, but then you end up having like a pain in a different place instead. So just be careful. Same for exercise, same for food intake, and really same for like even your work hours and your lifestyle in general. And everything in moderation also means if you have a treat, go a bit too much once in a long while, most of the time it should not be life-threatening.
To put it simply, I say that exercise is important. Everyone needs to have it. Even though when you're in pain, you need to have some form of exercise. The question is the right type of exercise. Yeah. So rather than completely avoiding, I treat arthritis of the knee, I treat arthritis of the hips, whereby the pain generator is very, very severe. The whole joint is, very, very deformed. And I will still tell them that you do need some kind of exercise. Contrary to what other doctors might say, you got arthritis, or you got back problem, you got leg problem, please don't exercise, sit down, wheelchair everywhere. So I always say, no, you do need to have the right form of exercise, not zero exercise. Second thing is that I'm very anal about if pain affects the patient's sleep or the quality of sleep is affected, we need to try to correct that, because that will build up the reserve for the patient to be able to manage how the pain interacts with the patient in the daytime. So in nighttime, if the pain comes on and affects the sleep, or the sleep is affected by the pain, or the quality of sleep is poor because of the pain, we need to address that. Don't leave it aside, because that in itself will be a problem.
Okay, great. Jem, I would like to ask you the same question, but I know it's going to be a tough one for you to answer since you're living in pain. How do you live a happier life now with pain?
Yeah, I think mainly because I'm naturally a positive person, so that helps. And then besides that, I also exercise. I cycle quite a bit, and then because cycle will not give me pressure on my shoulder that much and my neck that much. So it is good for me. So I think everybody with different pain should go for their different exercise as well that is suitable for them. And then I think going out to breathe fresh air, even when you are not feeling well, you will feel a lot better rather than to stay at home and just rest. I mean, yes, you need the rest, but you need the fresh air as well. So besides that, also manage stress because like even when maybe some people manage stress by just resting, but I think or Netflix. So but I think to me, I feel that it helps me when I sing or I scream. I go and watch a horror movie to scream it out so that I can let go. And then at the same time, maybe I take breaks to prevent burnout as well. So now like I'm on holiday now. So that's why yeah, I think burnout is also one of the factors that give me more pain. And don't be in the same position for too long because like using the mouse for too long, it hurts my shoulder as well. So need to stretch. And then at the same time, I think although it is not good to always take so many painkillers, sometimes when necessary, it is better to take so that you will have lesser pain and then you won't like keep focusing on the pain and then you suffer even more because it will just accumulate more.
Thank you for all those perspectives. A life without pain is unheard of. I think we'll all suffer some sort of pain. Could be small, could be big at some point or other. But how we address it and how we face it, those are key to the whole process, I guess. And thanks to our panelists, they've talked about moderation, in moderation, exercise, the need for sleep, and managing your stress and screaming at a horror movie. Lots of outlets for you to sort of help cope and deal with your pain. It's a big topic. I don't think we've done enough justice to it, but thank you, Dr. Bernard Lee, Suwan, and Jem, for all that you have shared, because I think it has also helped us understand how we can maybe approach it in a slightly different way, in a way that helps us. But I suppose the best thing really is if there is pain, try and figure out what's the cause of it and try and get it addressed as soon as possible.